we are going to move on to our next topic and stay with Kelly here. But one of the big topics that he talked about is talking about our aging population and what does that mean. And so we're going to be covering rural nursing facilities and what does that look like for workforce, for beds in nursing homes, for skilled nursing? So I'll turn it back over to you.
Yeah, thanks. You get to hear from me again, and I apologize to anybody that's listening. I've been quite sick, which I think the entire state of Minnesota has been sick for about a month. And so I may kind of get a kind of a scratchy voice here in a second, but we're going to keep doing that. So we're going to cover some things. This has been a topic that I feel like a lot of folks in rural Minnesota have really started to wake up to a pretty harsh reality of we have an aging population and we're all trying to figure out how we're going to care for them. We did a report on this that was released last November. So check it out again on our website. This is kind of the highlights of it. One thing I wanted to take a look at is, okay, well, let's think of this as almost like a business. We have demand and supply. The demand is how many nursing beds are we going to need projected out in the future? And I guess this gets back into your projection question. We do a few projections here. This particular chart, what we did is we looked at, okay, today there's this percentage of the population, 65 and older, that utilizes a nursing bed. Oh, thank you. That utilizes a nursing bed. So if we take that percentage and project it out to the numbers of the aging population over the next, out until 2055, how many beds is that going to be? Because we know this 65 and older group is going to get older and older and older. And what you can see here is that a lot of places we haven't peaked yet, but we're going to be peaking, particularly in our most rural counties where they're looking at peaking probably around 2037, where we're going to have the demand for just nursing beds be at an all-time high. That's the projection. You could see in our other county groups, it increases and they peak around 2045. That's just due to kind of the demographic makeup of our counties and how much they vary from rural to urban places. But again, you can see some pretty significant increases coming up here over the next 20 to 30 years. So if we have demand increasing, what is the state of the situation of the nursing beds that we have available? And the sad news is that we actually have a decline in nursing beds. Since 2005, the entire state of Minnesota has lost a third of its licensed nursing beds in the entire state. We've gone from 38,000 all the way down to 25,000 since 2005. And that most recent data is 2024 data. But not all things are equal across Minnesota. So you can see here on this chart, our most rural areas have actually lost 40% of their nursing beds, where our more urban areas, it's closer to a third or 29%, somewhere in there. So more severe declines in our rural areas of the state. So why? Why are we having... I want to say the important thing about bed declines is that there's actually two ways in which you can have beds kind of disappear from the licensed portfolio or whatever. One is through just total facility closure. Probably a lot of rural communities have seen this happen in their communities where a nursing facility just up and closes, and so all those beds go away. The second way in which you can have bed declines is that you could have a facility reduce the number of licensed beds they have available. So let's say they have 50, and then one year they may say, you know what, we're only licensing 40 of them. So that space is still there in that facility. It's just unused and no one can take up those beds. And we'll talk about why they're doing that in a second here. But those are the two ways. Now, why is this important? Well, you can imagine if a facility closes, it's closed. There's no expanding the number of beds that we might have available in that facility because it's gone. Whereas if a facility reduces the number of licensed beds, then you can still potentially have an opportunity to expand the number of beds available in that facility because they're still there. We just have to go through the licensing process again. But that's also going to depend on some factors that we'll talk about in a second. But we would love to see more facilities have bed reductions than closures so we can hopefully meet that demand in the future. So percent share of bed reduction. So the red is the percentage of the total beds reduction that have closed versus the ones of facilities that have shrank. And you can see in our entirely rural counties, almost 60% of the bed reduction has been due to closure, not because the facility is shrinking. whereas the other ones are almost equal across the board, where it's that 55 to 60% are reducing due to shrinkage rather than the 40% due to closure. So why is there so much decline? So this is it's a complicated question, but if you were to ask anybody in the field, you're going to get two pretty solid themed answers. There's the long-term kind of trends and changes in policy that have been occurring that have collided with the most recent impact, which is workforce shortages. And so these two things have slammed together to create kind of a precarious situation. And I think you talk to anybody, any of the associations that represent our nursing facilities and even assisted living and our home health care, this is a big deal. This is something they're talking about and seeing all the time, and it's really getting pretty intense. Just real quickly, what were those long-term trends and impacts? Why is there so much decline? So one, it's kind of some historical context here. So, back in the 70s and 80s, really all you had was skilled nursing facilities. There wasn't much, if anything, that was what we would consider assisted living or even home health care, right? Like those things were not really existing. So it was either you lived in your home or you were in nursing, like a skilled nursing facility or a nursing home, as we kind of call it in the field, right? But there's always been a little bit of negative perception around skilled nursing facilities because sometimes people were there that didn't need to be there, right? They weren't that bad off, but were stuck there and had to be there. And so there was just a lot of kind of not great perceptions in skilled nursing facilities. On top of that, they are also quite expensive. And so the federal government, who would help fund and make sure people were taken care of in these nursing facilities, were looking to be like, okay, how do we reduce the cost of this? And it met with this perceptions idea of like, okay, maybe we need to kind of support and develop a continuum, more of a continuum of care where people can have a little bit more choice, where it's not just a nursing home, but maybe they just need an assisted living or a memory care unit, or maybe they can live at home, but they just need a nurse to come once a week and help them out, right? Let's get that. And so that ended up kind of creating a market there that took up more of the elderly patients away. Now I say away from nursing homes, but there was just ended up being where nursing homes take care of the most acute patients, whereas assisted living in those take up ones that aren't so acute. This is all good things. We also had advances in technology that have made it easier to receive care in non-institutional settings. And then the changes in state and federal policy that has allowed payments that used to maybe only be dedicated to nursing homes now be allowed to help fund somebody's stay in assisted living, a memory care unit, or to fund home care, home health care. So these are all kinds of the context of all these changes that have occurred since the 1980s and really sped up in the 90s and the 2000s. So one thing that happens is small facilities then lack the economies of scale. If they're only caring for the most acute patients, and there's only a few of them, the high overhead, high costs, it just makes them really hard. This is Carrie Swanson, CEO of Cornerstone, who says cost of supplies are up, wages are up, but payments have not increased enough. Lots of rural facilities are small, and they can't cut any more corners or scale down enough to make the finances work. And I should correct this and say it wasn't that they can't cut any more corners, but rather it's just not about cutting corners, but there was just no way to reduce costs without it impacting patient care. And that's just so important. So if we look at that kind of going along that thread of do these smaller facilities have the economies of scale to make it, we have to ask this question: if you're small, can you survive? And so what this chart shows is every black dot is a nursing facility in Minnesota, and where they're located. Are they located in an entirely rural county versus an urban town, rural mixed county? And then the orange line is the closed facilities, the average bed capacity. And the orange line, or the red line is the red line is the closed facilities average bed capacity, and the orange line is the median bed capacity. So you could see those lines where all the facilities that have closed since 2005, their average bed capacity is much closer to the bed capacity of our entirely rural facilities. So again, just showing that the smaller you are, the harder it is to make a go on this business model in rural Minnesota. And then getting back to this other piece of the most recent impacts, which is workforce shortages. So occupations of registered nurses, home health and personal care aides, nursing assistants, orderlies, psychiatric aides. You can see this is the number in each of our planning regions that have been in those occupations. And you can see there's been some growth, but even since 2020, a lot of decline. This has been a big problem among particularly nursing facilities trying to find labor. They had a lot of folks leave the occupation during the pandemic and have really been trying to recover since then. So this is one quote from one of the people that we did interviews with, already not meeting the need due to workforce shortages. We hear this a lot in the field. We are screening patients to make sure we have the workforce to meet their needs, and we are turning people away daily due to the lack of workers. And this is a small rural facility. And so they are at capacity, and until they can find workers, they can't take in anybody else. And so what this means is that particular patient has to go to someplace maybe further to see if they can get in, and maybe even further than that to see if they can get in to somebody that can meet their needs. So I know this is kind of a downer of a report, but we're going to be there's a lot of really good things coming out of this kind of whole industry over the last few years, a lot of interesting initiatives and ideas. We're going to be having a podcast episode come out in 2 weeks where I interviewed the executive director over at Leading Age Minnesota, as well as the kind of elderly care person at Perm Healthcare. And it was a great conversation talking about just some of the really interesting things they're doing to really bolster their workforce in their nursing facilities and assisted living facilities. That's going to be coming out. We're going to be publishing some more reports that are going to try and start looking at, like, okay, what are the changes that need to be made, and what are the ideas being implemented or thought about or talked about in the industry to help figure this out so we can meet that demand. With that, we'll be on this elderly care issue for the next 2 years for sure. This is the first year. We're going to be doing it for 2 years moving forward. It's a major theme that was identified when we did interviews to figure out what our research agenda was going to be. And so be on the lookout. We're excited to keep digging into this. We know how important it is to all of you.
Absolutely. Thank you for that. And a question has been asked if these slides will be available, and they will. Each of our research reports, you are able to go to our website, ruralmn.org, and go to the research reports, and there's slides there. And like Kelly was saying, we also do podcasts, we do blog posts, videos, webinars. We have a YouTube channel, so make sure this will be recorded, is being recorded, and will be on our YouTube channel as well. But I do like the comment here from Erica, that is crazy. There are only 3 of you at CRPD. Thanks for the work. Yes, we're small but mighty.
Yeah.
And these two make it happen. They make it happen. And so it's great when you're passionate about your work and what we do. So look forward to the next couple of years in our research agenda.